All right, let's go ahead and get started with this. One quick note that I put in the chat box, just a reminder, if you do have questions, please put those in the chat box. We'll get to those as time allows. Anything that was not addressed, we will be sure to get out a question and answer document afterwards. So don't hesitate to put those questions in the chat box. And Val, I know there are still a few folks rolling in. I think it's kind of slowed down, but I will go ahead and turn it over to you.
All right, thank you, Heike, and thank you, Heike, for setting this up for everyone. I appreciate your time today. I know that last week, I don't know if it was Thursday or Friday, I lose track of time during COVID, but I know that there was a statewide message that went out about the Corley Pulse Survey, and there was a lot of information in there. I know a lot of the start of that presentation, and we've talked about this as a state, is just laying out just the basics of the Quarterly Pulse Survey, what we do it, why we do it, and why the state thinks it's important and why the department thinks it's important. And I just kind of wanted to quickly go over some of that with you. I don't have a slide for that specifically, but I was talking to somebody who in central office last week about the Quarterly Pulse Survey. And one of the biggest things about the Quarterly Pulse Survey is, and I get this when I do town halls too, is the Quarterly Pulse Survey really confidential? And as a person I was talking to discuss the fact that, well, by the time you put in your salary, your location of where you work, it doesn't feel like it's very confidential. And so I wanted to share with you all how we get the results back at the department level. So I get the results by location, as long as there's more than 10 people by location that answer, and we're big, so we always have more than 10 people by location that answer. And we'll kind of, anyway, so that's good. The second thing, though, I wanted to share with you is that when I get the data back to me and it's by salary, it's all of the people that participate in the survey by salary. So I don't get, for example, I'm going to pick one of the smaller regional offices that we have. So I don't get Sykeston Poplar Bluff Regional Office by salary. I don't get it that way. I can't see it that way. That's not an option I have to look at. So I don't know if that helps ease some of the burden around if this is confidential or not, but I just get it in total. So if we had 3,000 people do the survey, I get it in total for all 3,000 people who did the survey by salary increments. I don't get it by location and salary increments. So this is a really good question that I got, and not something I never thought about, because I always see the results, and I know that you can't tell that. I can't, short of somebody writing their name in an actual comment, and we do get all the comments, I can't tell who this is coming from. Now, occasionally people do put stuff in the comments that make it pretty easy to figure out, but for the most part, you cannot tell. So I just wanted to get that out there, that it's confidential. The second thing I wanted to put out there again is why it's so important to us at the state agency level, at executive office level. We're a big agency at the Department of Mental Health. We're 7,000 employees. We are spread across the state. And especially during COVID, we can't get out. We can't come see you. We don't have a lot of you going into the office. And so because we can't get out and come see you, because we're working totally different now, or because you may be in a facility and we can't get in there to see everybody because we are trying to protect as many people as we possibly can. This is the way that we hear what's going on in our workforce. And for us, that is very, very important. So I appreciate every time someone does a Corley Pulse survey. I doubly appreciate it when they take the time to put comments in the comments. We go through every one of those comments, whether it be me, Valerie, and the director of the Division of Developmental Disabilities, or Dr. Gowdy. That's where the bulk of our comments come from. With the Division of Behavioral Health, we both look at those comments. We take those comments very seriously. And so I just wanted to share that with everybody. So those are kind of the two big things, just from my point of view on why this is important and the questions that we continue to hear. So I hope that helps. And if there's some questions in the chat, we'll look at those in a little bit around that. But let's get started. And please don't be upset if I look away, because I have this on my little screen and then I've got this on my big screen, and sometimes I need the big screen. So one of we always look at like I said, we always look at the comments in the Quarterly Pulse survey. And this time the question, it wasn't as much free text like it usually is, but it was a specific question. And the question was, can you share an example of where a colleague has done something exceptional to help a colleague, team, citizen, or other group during COVID-19? And we had usually we have about 2,000 comments. We had a lot fewer comments to the answer to this question. But we had some really, really, really nice things. And of course, I can't put all 350 comments in here, but I did just want to share a couple of those comments. You know, we did have a lot of people making masks at the beginning to help everybody out. I know that was a huge support, and we could not have really weathered those first few weeks without that kind of support. I know that we're all helping each other, and that was kind of one of the things in the comments that we got, just everybody helping each other. In the facilities, it's direct care staff helping direct care staff, making sure we have people that do the job that we need them to do and support the individuals that we need to support. I like the one that said they are the unsung heroes of our workforce. They always are the unsung heroes of our workforce, but during COVID, they have been invaluable. I mean, there's no words really to describe, and there's so little that we can do to show our appreciation. But we do say thank you, and we try to do everything we can to protect them in the work environment. I know another one, people who just volunteer to help at facilities, and I hear these stories all the time. And I know in certain parts of the state it's easier than other parts of the state, but I know that it is just greatly appreciated across the system when we help each other out. So those were really, really good themes of the comments that we saw, and I just wanted to share a couple of those with you. Of course, you can read these, and this will be made available. One of the big keys to the Corley Pulse Survey, though, and let's get into the details of the data, is, oh, wrong, I have two mouths going on right now, is the participation. And this was the October Corley Pulse Survey, was one of the lowest participation levels for the Department of Mental Health. But also, October was really the start of some of our bigger outbreaks in our facilities, and that's where the bulk of our employees are. So when you're trying to social distance, when you're working with decreased amounts of staff, and when you have folks that are COVID positive or managing individuals that are COVID positive, it is hard to get these done. A lot of our facilities don't have access to computers easily, and in order to do that, you would have to undo your cohorting of staff or things like that, and we don't want them to do that. So you can see this is since we started doing Corley Pulse surveys, kind of what our participation has been, and this last one here is 1,916. So, but good, we still get good data from that, and really grateful for everybody who takes the time to do the survey. Next, I kind of want to talk about we do a quarterly pulse survey every quarter. So the next one will be, I'll show you that at the end. It'll be a nice surprise if you didn't watch the video already. But there are 5 key components to the quarterly pulse survey. And I did see this in one of the comments. They don't ask the questions I want them to ask. Well, they'll ask those questions, those other questions about leadership and communication in the next round of the quarterly pulse survey. But this one was focused on 3 areas. It was focused on accountability, it was focused on motivation, and it's focused on external orientation, or really our citizen focus or stakeholder focus. So I wanted just to kind of show you or let you know, across all of the majority of our locations, we saw major increases in how staff felt we were doing around accountability, and that's at the manager, supervisor level, all levels of managers and supervisors. That's a 9% increase as an agency across the board, and we're now really up to that same level of statewide, that 67%. I mean, 67% of our employees agree that we're doing good work around accountability. That's for the state. For the department, 66% of our employees believe that. And you can see over here on the right, there's role clarity, there's performance contracts, there's consequent management, and there's personal ownership. These top boxes represent the state as a whole. So there were 40,000 plus employees that completed this for the state. That number's not right, so don't quote me on that. It was in the Thursday one, and I can't remember what it was. But 58% of all state employees felt like role clarity was something they agreed with. And for the Department of Mental Health, 55% of our employees agreed that their role was clear. For performance contracts, 58% of employees agreed that they knew how their performance was measured. In the department, that's 53%, a 4% increase for the Department of Mental Health. Consequence management. So this is really kind of that authoritarian type leadership. In accountability, 22%. For the state, 23% for the department, so we're really on par there also. And personal ownership, which this is what I'd really like to see us increase on. This is questions in this category can be, do you really take ownership in your job? And for the state, that's 57% of employees agree they have personal ownership in their job. For the Department of Mental Health, that's 53% of employees, but that is a 9% increase. So all of our accountability areas have really gone up. We're really on par overall with how the state is performing under accountability. Employees, one of the questions that was specifically asked was, are employees employees clearly understand what is expected from them? 59% of employees agreed with, and this varies by location, so don't forget you pick your location whenever you do the QPS. 59% of employees agreed, from 59% to 90%. So we do have some locations across the state that have really high accountability factors, which is great. And we had increases over September of 2019, which was the last time we looked at accountability, over every location, and in most of those places, those were double-digit increases. Our highest increase of the number of employees that moved to agreeing in accountability was 19%. So, you know, before this survey, almost 20% of the employees at that location did not agree, and now they do. So there's leadership and supervisors who are doing a good job of moving that accountability needle. I do like to give DAS, that's the Division of Administrative Services, a little bit of a budge here because they had the lowest increase for all of the divisions or locations across the state at 5%, but 90% of their employees already understand what is expected from them. So those are really good numbers. Director Stringer, who is listening, just texted me and he asked me if all of the comments, why we can't see all of the comments in the chat if it's set up that way. And I believe the answer is yes, but Heike, I am leaving that to you. So if you want to post something into the chat about not being able to see all the questions or the comments, that would be great. The second area for this quarterly pulse survey was motivation, and I won't spend quite as much time on that because I really wanted to focus on accountability to let you know kind of how we look at the survey. But under motivation, this outcome as a department increased by between 8 to 40%. So, and you can look over here, meaningful values, inspirational leadership, career opportunities, and rewards and recognition. And you can see the state level for meaningful values and motivation was at 46%, up 7%. For the department, we're at 43%. 43% of our employees agree that we have meaningful values. Inspirational leadership for the state was at 45%. Again, the department, 43% of our employees agree that we have inspirational leadership. Career opportunities for the state, that's at 21%. For the department, that's at 22%. So how do we motivate employees with better career opportunities? Only 22% of the employees at the Department of Mental Health agree with that. And rewards and recognition, that is 24% for the department and 24% for the state and 24% for the department. We know that motivation, especially when you're looking at recognition, rewards, non-financial incentives, that is really probably the lowest area for the state across the board and for the department, and it's something that we continually try to figure out how we do a better job at. So stick with us on that. That would be great things to put in comments next time you have a quarterly full survey. What are your ideas around that? And we'll continue to ask, and I know all of the state agencies are looking at that right now. The other one that I really liked a lot was how many of our employees think that we practice inspirational leadership. And that is up 8% for us as a department. You can see that. So 43% of our employees agree that our levels of supervisors, managers practice inspirational leadership. External orientation is kind of the hardest one to explain, although probably easier for us than most agencies because we do directly serve folks. I mean, our job is to try to keep people independent, living their lives, living the best life they can live. And we're going to look at how we were successful under this for COVID-specific questions, because there were some COVID-specific questions for community engagement, and that's more at the end. But just overall, how many of our employees believe we have a citizen focus? 33% of our employees agree that we have a citizen focus. For the state, that's 37%. And then competitive insights, 36% of our employees agree with that versus 37% for the state. So moving on to the next slide, we're going to look at benchmarks by work status. So this is another question that got asked, and this is exactly how I see the results. So if you were having, again, questions about confidentiality, this is all I can see around if you selected remote work, in-office or in facility, or hybrid part-time in-office or in the facility. And they just looked at accountability in total, motivation in total, external orientation. So this is all I see. I can't see this by location. I can't tell by location how many people are working remotely and then how they answered the questions. But I like this because what this tells us at a management level is that, for the most part, accountability across the board still very high, no matter what the work status is of our employees. 80% if you're completely remote, 72% if you're working both ways, 59% if you're in office or in facility, agree that we are meeting some accountability standards. Now, motivation is where it gets a little trickier. And if you look at this, we had 29% of our employees who work in office or in the facility, and this number right over here, this 1,232, that represents the number of people who selected that. Only 29% of our employees think we're doing a good job, agree with us that we're doing the right things for motivation, and of the folks that work in office or in facility. Our remote employees was the highest at 63%. So I like this because we have to do a better job of explaining those in office or in facility and look at different ways to motivate folks that are working in office or in facility possibly compared to our remote or hybrid workers. External orientation, again, how we relate to the community, and you can see here we are again in office or in facility. 33% of our employees who work in that type of environment agree that we're doing a good job with that external orientation. 66% of our remote workers agree that we're doing a good job with that external orientation. So interesting. This is the first time we have looked at these categories by this type of breakout of where you work. So we don't have anything to compare them to, but I look forward to seeing what happens on the next Corley Pulse survey, but the one after that, so that we can start seeing some way to compare this type of information. Moving on, I pulled out specifically 3 questions to look at, just because to me these are really important, especially right now during the time of COVID, because we need everybody on deck and we need everybody putting everything they have out there in their jobs at this point in time. And so we looked at 3 questions. We looked at how many employees agree they have a personal stake in their work. So if you look at it by location, the lowest location, only 35% of employees agreed they had a personal stake. 85% was the highest by location of employees that believe they had a personal stake. Our average is about 53%. So 53% of our employees agree they have a personal stake in their job. How many employees agree they're generally enthusiastic about their job? And this one hurts a little bit. 19% agree, that's our lowest level of agreement, that they're generally enthusiastic about their job. 69% is our high, still not, up there in the, great areas. 40% is our average of employees that are generally enthusiastic about their job. And that doesn't surprise me when you look at our motivation scores across the board. So definitely got to work on those rewards. I think that hopefully that helps. We think here in central office, at least I know, we could not do any of this. You guys are doing an amazing job out there. We're so, so grateful for everything that you're doing. Jobs are clear and accountable. That's the third question I wanted to look at. So 43% was the lowest we got in this category. So 43% of employees at one location agreed that their job was clear and accountable. High was 81% of our employees agreed at a location that their job was clear and accountable. 15 of 22 of our locations were below 50% in this category, but our average was 56%. So I have one more chart to kind of show this, and of course it doesn't detail which location we're talking about, but it does. So each one of these represents a location that you can select whenever you're doing the Corley Pulse survey. So that could be, I'm going in alphabetical order, Bell Fountain Rehabilitation Center. That could be Central Office Division of Developmental Disabilities. So I put a red line here because that kind of depicts where the 50% is, so that you can kind of see how many fall by location, how many are way above, versus lower or below the red line. And, you know, I think what this shows me really specifically is that we have a lot of different feelings in our work locations across the state, but we do a lot of completely different work across the state too. So as a supervisor and a leader in the department, I want to try to figure out how we get some of these up above this red line for sure. And I also, at the same time though, I want to make sure that we're maintaining what we're doing above that red line as well. So lots for us to work on, and we continue to look at these results and try to figure out how we can make those improvements. The last thing I wanted to show you, and I alluded to this a little bit earlier, there were 3 specific questions in this survey about our COVID communications, and they were special questions. They're right over here. And we, as a department, I think fared relatively well. And if for those of you that saw the state, we were actually on par with the state as a whole. But leaders in your organization provide the information you need to work safely in the COVID-19 environment. 76 of our employees who took this survey agreed with that. And that helps. I mean, we need to figure out how to get the other 25% there. And we know there are struggles with testing still in some places. There's struggles with the adequate PPE, and we continue to work to manage those. But really like to see those kind of numbers. Employees are adapting to workplace changes due to COVID-19 while still delivering expected results. That one's also 76%, which makes sense to me with our accountability numbers being as high as they were. And then the last category, the organization provides external stakeholders and interested citizen groups relevant and timely information to help through COVID-19. And only 57% of you agree that we're doing a good job of that. And communication is hard, it's exhausting, and it's doubly hard when it changes as often as it does in COVID. And I did see that a lot in the comments that came back, our COVID comments, that you hear one thing one day and then we change it the next day. And yes, we do. We don't like doing that. Unfortunately, COVID is not as black and white or something we're used to. There's not a playbook out there on how you deal with COVID. We are learning as we go, and we're so grateful that all of you are learning with us, but understand a little bit why this would be a lower benchmark for the state, because we may tell you something today, and I say this on our biweekly community calls that we have, and it'll probably be shades of different the next time we talk. And so while that's something we can continue to work on because we cannot over-communicate, it is especially at a time like this. I know how frustrating can be out there whenever you're hearing different things all the time. So thank you for sticking with us on that. The next Corley Pulse survey will be January 25th to February 5th. I try to think ahead, and you know, in my head right now, I'm thinking how many people that we have working for us will have gotten the vaccine, because I want to be positive right now. And how many more will be getting the vaccine. The same for our community, the folks that we support in the communities, and all the direct support professionals out there that work with individuals that we support. Hopefully we're able to protect as many of those folks as we can. And in, you know, just a month, we'll have a whole different story to tell. So I'm going to go now. I'm going to pull up these questions. Okay, there's a lot, so I'm going to have to thank you. I'm glad you like my hat. Oh, wait, maybe I can see them over here. Okay, I'm going to look over here. Okay, so we did sound check. Something confusing because results show up same time the next survey comes. Sometimes it's confusing because the results show up the same time the next survey comes out. I agree with that. So one of the things that's going to make that better, so this time we are almost a month ahead of schedule, is that we are now using Tableau for our results, so they are more real time. So hopefully this time COVID got in the way. So this was the first time we used Tableau for results. So you finished in October, and then you saw the state results last week, and you're seeing our department results today. But hopefully that gets better. It took a while to get the state results put together because the guy that does the QPS survey is also the guy that does all of our data for the fusion cell on COVID. So, but hopefully that gets better and we keep moving that up more quickly, but putting them in Tableau has made it much easier to work with. It used to come to us in Excel on a flash drive, just like this. And then we would have to figure out how to work with the data. So it's gotten a lot better, and I think it'll continue to get better. April says hers was totally blank. Okay, that was about the chat box. Okay, chat box. Okay. Okay, these are all chat box. Thank you, Heike. How is the statistic broken out? We have high and low. Okay, I'm not sure what that was related to, so I can't really address that one right now, but if you want to, there was a question sent in, how is the statistic broken out? We have high and low, and for some reason my brain is not comprehending on where that was at in here. Okay, are there any other questions for the chat? Let's see. Thank you again, everybody, for taking the time to call in today. I do really appreciate it. I hope you found this information helpful. You were able to learn some stuff from it. Okay, I got a new question. It's been a long time since I had psychometrics and survey research. So my question is, do you believe your N is large enough to get useful information? Excellent question. Let's go back to this. Okay, and I got to hide this. Oh, you can, oh, no, you can't see it because I had the attendee list open. I got stuff open. I'm getting there. Sorry. Okay, I think if I just click on this, it'll work. Okay, so we actually, right now for October of 2020, are not considered statistically valid with our 1,916 resultants. With that, so that's across the department. With that said, we do have really, really high participation in certain divisions and in certain locations. So really, the participation is the lowest at our facilities, and that's where the bulk of our employees are. So that's what kind of brings us down. But if you were looking specifically at the regional offices or central office staff, those percentages are high enough to be statistically valid. So correct, as a department, not really statistically valid, but by location, we do have lots of levels of validity. So I hope that helps. And that's something that we look at our level, at my level, and then we share with the division directors so that they can make the most out of that information. So great question. Also like it when I can answer them. Okay, we'll see if there's anything else. No one's dropping off, which makes me happy. Okay, moving this over. And okay. Yeah, Hope, thank you. She said 1916 should be a valid sample size statewide. They want us above 50%. So while it is probably a valid sample size statewide, it's by location. When you've got 400 employees and 30 take the survey by location, they aren't saying that that's good enough information. We can talk about that at another time also, and I can try to get more information on that. Does anybody have any concerns about the confidentiality or that at all? I know we hear that a lot, and I hope I'm able, by the way I show you the data, that's exactly, these pictures right here are exactly how I get the data. So I hope that, you know, and I actually just take these with a little snippet. I cut it right out of Tableau. I hope I said Tableau, because I love Tableau. All right, well, everybody, I do appreciate your time today. Thank you for listening in. Please, again, always let us know if you have any other questions. We look forward to our next quarterly pulse survey, and do have a good week. Enjoy the sunshine, and have a happy holiday season. Thanks. Bye, everyone.